You don't have inherent healthy competitive detox pathways to get rid of this stuff. Low levels are becoming higher all the time. Multiple toxins are compounding the issue, and it's not even being addressed. This is not a problem that I've identified. This is recognized by our Environmental Protection Agency, our Food and Drug Agency, our Centers for Disease Control, our individual state health departments. This is a problem worldwide. Treatments, we've got to get into prevention. We've got to get medicines with proven results or medical comprehensive approaches and get out of crisis management from the accumulative damage that these things do. Now let's talk about the damage. Let's go to some peer-reviewed literature. Archives of Internal Medicine 2002 published that levels that are low, the key word, ladies and gentlemen, up in the title is low lead levels, low lead levels. In the National Health and Nutrition Educational Survey number 3, under 30 micrograms per deciliter, you're considered not at risk. Well, let's look at some parallels. Let's look at cancer. Do you see that almost 70% of all cancer deaths are linked to low levels of lead? I'm going to repeat that. Do you realize that nearly 70% of every cancer death is related to low levels of lead? And that's just one metal, and we have multiple levels in us. Every one of us in this room is sitting here with it. Do you realize 50% nearly of every cardiovascular death is linked to low levels of lead? When you have high blood pressure and you go see your allopathic physician, how many of you had the doctor say, well, let's check your lead level? Do any of you have an idea what lead does to the lining of your blood vessels? It burns it. Remember the vision of that membrane damaged? There are delicate communication entities in the membrane, one of which is nitric oxide synthetase, an enzyme that helps make nitric oxide for the dilation of the blood vessel. Well, if you're damaging the ability to dilate and relax your blood vessels through the action of nitric oxide because it's being damaged by gradual accumulation of lead, wouldn't you expect to have a problem? Yes, you would. And it says it right here. Now remember, 30 micrograms per deciliter is considered acceptable. And it used to be 60 micrograms per deciliter before. The World Health Organization talked about that. Okay, in my patient population, I have looked at hundreds of my patients, and 100% of every patient that I got a drop of blood out of them, just a single straight drop, had heavy metals, multiple. Nobody had none. Nobody had one. Everybody had 3 or 4 or 5. Probably would have found more if the test surveyed for 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 or more. Okay? So, every one of us in this room has this problem. It's linked with 70% of our cancer deaths, half of our cardiovascular deaths. Why aren't we discussing this? 22% of those found were in elevated ranges, even above the acceptable ranges, and 17% were in potentially toxic zone. Add those together, that's 39% of the 100%. Nearly 40% of my random patient survey. Ladies and gentlemen, we have a problem. All right, quickly, I'm going to run through this. It's everywhere. Sources of aluminum, one of them. You can see them, your cookware, aluminum foil, antacid, antiperspirants, lipstick, on and on, tap water. Health conditions associated with aluminum, respiratory problems, coughing, asthma, Alzheimer's. About 1 in every 40 seconds is newly diagnosed with Alzheimer's disease. Wonder why. Bone disease, skeletal skin rashes, neurological development in children. Sources of toxic metals, arsenic, air pollution. It's in sampling of our air. Where is the arsenic coming from the air? Antibiotics given to their livestock, drinking water, fish, insecticide, herbicides, meats, pesticides, seafood, glass, wood preservatives. Do you know that they're advising you now not to let your children play on the deck you built for them? Don't play on the deck I just built for you, or wash your hands. Put a pair of slacks on her so she doesn't take, my husband's a carpenter. I helped him build decks. Even when I was a doctor, I enjoyed it. Okay. Arsenic, fluoridation, arsenic, the hazardous behind the faucet. It's now being considered a class 1 human carcinogen. The Environmental Protection Agency has proposed reducing the minimal level of exposure from what they said, 50 parts per billion to 5. Thank you. Health conditions associated with heavy metals, arsenic, lung cancer, skin cancer, bladder cancer, liver cancer, kidney cancer, prostate cancer. Other associations with cancer would be sore throats, lung irritation, nausea, vomiting. I would tell you about 99% of everybody coming to my clinic in the past 7 years has a low white blood cell count. And after working with me, they get better. Abnormal heart rhythms, palpitations, not treated with beta blockers and Coreg and so forth. They got better. Damage to blood vessels, pins and needles, tingling, darkening of the skin, small corns or warts. Interesting. What are the sources of cadmium? All right, again, air. It's the air we breathe, ladies and gentlemen. Bone meal, cigarette smoke, in the foods, coffee, meats, fungicide, incinerators, mining fungicides, batteries. Every time you're handling your batteries, oxides, paints, just look at the list. What about side effects of it? Vomiting, diarrhea, kidney disease, fragile bones. Do you know that when they're incidentally doing osteoporosis studies on what is demineralizing bones, they're finding lead pour out and other heavy metals? They're finding lead pouring out of the minerals of the body. Your body's so starved for minerals, it'll take up lead or cadmium. And men's prostate looks like they're taking up cadmium. Close correlation with that in prostate cancer, the #1 killer of men. Okay, mercury. We've heard a lot about mercury. I won't spend a lot of time. It's in the air. Everything's in the air. Cosmetics, batteries, foods, tap water. You can see the list. It is everywhere. Our teeth, you know about that. I won't say much. We absorb it. It accumulates in our critical organs, brain, kidneys. When I tested my own 2 sons, I had 16 fillings of mercury in my mouth. I gave birth at age 28 and 30. When my sons were 18 and 20 years old, I did heavy metal challenges on them with EDTA IV treatment with 1 DMSA 500 milligram, and they all had elevated levels, and none of my sons ate bad. I made them eat. I crushed up the vitamins. They did what I said. And they had heavy metals. They had toxic levels. They got them from me, most likely, and maybe the fish. Okay, aluminum is linked to Alzheimer's disease. 7 studies are related to this research and implicating it. Case control studies show that the lifetime exposure of aluminum in your antiperspirants and acids will put you up as much as 300% higher risk of this. Lead. Lead is another interesting one. Air, it's in the air. It's in, it was in the paint up until the 90s in this country. It's everywhere. You can just look at the list for yourself. And we have copies of my slides, if you like, afterwards at my booth. My booth is at booth 101, 101. But it impacts the central nervous system. Do you know that there are plenty of studies showing that violence and, untrainable behavior of adolescents increases as they get more urban in their training, where they're inhaling more lead. You get to more rural kids and their lead level's low and they're much better students and they're not as violent or reactive in their behavior. Kidneys, decreased reaction time, memory. It's a carcinogen, anemia. Okay, our children are more vulnerable. The oxidative stress of my parents was significant. My generation was very significant, and our children were compressing oxidative exposure, not only to heavy metals, but of course plasticizers, xenobiotics, dioxin, polychlorinated phenols, things like that. Okay, it's giving us premature birth, smaller babies, the mental abilities, learning difficulties, reduced growth, attention deficit disorder, you know the whole story. it's exploding. Okay, nickel, you can see it in many things. I'm just going to jump through it here. You can look up nickel on the computer and how you get a hold of it. You can associate it with disease if you cross-reference nickel and Google disease, apathy, nausea, insomnia, dizziness. Just look at the list. All right, so we have a problem. These metals are associated with cancer. Look at skin, lung, bladder with arsenic, liver, prostate. That's why we're looking at this very seriously. Mercury. Look at all the cancers associated with all these metals. Good research. We need to look at this more seriously. Okay, we need to get them out of us. Well, if they don't come out of us naturally and they just build up and stockpile in us, then how do we do it? Yes, I know there's chlorella. Yes, I know there's cilantro. Yes, I know even high-dose vitamin C therapy has some chelation abilities. Yes, I know of these alternatives. But when I see people coming into me with angina, Alzheimer's, pre-demential tendencies, high blood pressure, cancer. I had a 15-year-old girl the other day come in, parotid gland cell cancer. 15! My God. Anyway. It's not right, so we got to get rid of this. So the EDTA has been approved, ethylene diamine tetraacetic acid, around 80 years for lead removal. It removes a wide variety of things, and I've done studies on this. It avoids the expensive IV time and invasiveness. Major research shows that 90% reduction in cancer mortality after chelation therapy in urban areas, in paired comparable groups, smokers and non-smokers. This is how we use it. It's in a suppository. There's 30 in a jar. We recommend 3 over a 6-month period of time, basically 1 every other night until you get through 90 suppositories. Now, does it work? That's what it looks like. Well, here's my study. I published in animal studies and human studies that the bioavailability, now, of course, if you put it right in your vein, that's the gold standard. The EDTA is 100% right into your blood. But if you put it in the transrectal methodology, 36% is absorbed. Do you know that's better than any other pharmaceutical transrectal delivery system of EDTA? Now, more importantly, if you look at the IV, the tissue penetration is very low. We almost quadruple the tissue penetration. And the time in the body was 1.5 hours to 8 hours. This is the product I've tested. This is the product I use. I no longer do chelation therapy IV. I only use it for testing modalities in a controlled fashion pre and post. We looked at children in one study. These children just gave us a urine sample, and the people who studied this found very little lead. We gave them 1 suppository of Detoxamin, 1,000 milligrams, and look at how much lead they peed out the next day. Is that incredible? Do you have it hidden in you? Yes, you do. And then we put them on a 30-day course, and they came down very nicely. Does this work? Yes, it does. We did a prostate study with men looking at chronic prostatism. We looked at the majority of these men having prostate cancer, and they had urinary symptoms. We used the chronic prostate symptom score that is an accepted study modality for their symptoms, and we had significant reduction in these male prostate studies. We also looked at the overall chronic pain, and it was significantly reduced. We did the International Prostate Symptom Score Survey in our study with Detoxamin. We also employed this with tetracycline and with a multi-mineral, and we're publishing this as we discuss it. We had significant reductions in many of these parameters, in many of the symptoms that men suffer from prostatism. Overall, we had a nice, statistically significant drop. Does this work? It certainly does. Here's a case study, just a random patient. I didn't look through my patient files and say, oh, go find me a good result. No, I just named off 3 names, and my office staff labeled it up. Over the years, here's a woman with chronic fatigue and fibromyalgia. Look at the arsenic level, 220, dropped within 6 months to 4.5. Look at her lead, less than half. Look at mercury dropping. Nobody can tell me that transrectal EDTA suppositories doesn't pull out mercury. Here's another case. Let's look at the mercury here. 30 to 2.6. Nobody can tell me EDTA transrectally does not reduce mercury. Here's the lead, nickel. Here's another example. Lead, nice drops. Cadmium is very hard. These people come back over years and years and years. Here's a hair analysis study, pre and post. So any way you look at it, this stuff works. It's non-invasive. It's quick and easy to use when you go to bed at night. It's inexpensive. 30 chelations in my office is going to cost $3,500, $4,000. 6 months, or roughly the equivalent of 30 IVs, is going to cost about $500, $600. It's safe. It's broad spectrum. It's FDA approved, and it's got an 80-year track record. I had a 63-year-old woman with ovarian cancer, metastatic, age 4. This was a death sentence. Her CA-125 was over 1,000. She had elevated liver functions. She did 45 chemotherapies with her oncologist in an integrative pattern of care. And then I gave her EDTA chelation and high-dose vitamin C. We do a whole program nutritionally, enzyme, antioxidant therapies, but I insist on detoxing them because of the high correlation with death rates due to heavy metals. It opens up the microvasculature. I don't care how good your vitamin is or how good your chemotherapy is. If it doesn't get to the target issue, you're wasting time. Chelation therapy opens the circulation. So, a year later, she had a PET scan, negative. Liver mets, clear, tingling, much resolved. Her CA-125 consistently 3 times in a row, 3 months apart, is 7. Blood count, chemistry, fasting blood sugar. We keep on a low carbohydrate diet so we don't stimulate their insulin. This stuff works. I have used this in hundreds of thousands of patients. Whenever you have a better blood supply, everything's better. Your mental energy's better,